So we'll start. So very good afternoon to all the respected doctors. On behalf of Hetero Healthcare, we welcome all the doctors for the webinar. Topic for today's webinar is the missing link in your enzymatic preparation. To shed the light on this topic, we have with us Dr. Sathish Kumar. So a small brief intro about Dr. Sathish Kumar. Dr. Satish is a MD of periodontist, MDS periodontist and implant surgeon. He has more than 15 years of experience in surgical and implant cases. Dr. Satish Kumar is a well-known speaker at various IDEA events. He has his own YouTube channel in name of Kazan Dental, which has more than 50,000 followers. Dr. Satish has authored two books, the BDS Launchpad and the Dental Launchpad. So we welcome Dr. Satish to this webinar.
Thank you, Dr. Nitin.
A small message to all the participating doctors. In case you have any queries or doubts, you can just type in the message box. The queries, questions will be answered at the end of the session by Dr. Satish. So I hand over the session to Dr. Satish. In continuation. Yeah.
Thank you. Before we even begin, there's something I want to tell you which is always nagging my mind. You might have completed your BDS maybe a year ago, maybe 5 years ago, maybe 10 years ago. Even after studying for 5 years, as dentists, we keep on learning. You might have just gone to your clinic in the morning, would be going to your clinic in the evening, and you've taken out time in the afternoon to sit and listen to this lecture. Not just that, even in weekends, that's Saturday or Sunday, you take out time and you go and listen just to upgrade your knowledge. And it's not just when you're young as a new dentist, it's even when you're experienced, maybe 5 years, 10 years, 15 years into practice, you have this thirst to keep on learning. And it's seen across all dentists. My question is, why do we put in so much effort? What is that we as dentists want? And when dentists sit in a casual discussion, you'll have a variety of answers which would come across. The first and most simple and easiest answer is, I want more patients. I'm not satisfied with the number of patients I have, or I'm satisfied, but I want more number of them. So I want to upgrade my skills. The second is, I want more money for myself, for my family, for the people I take care of. And the third is, I want more satisfaction from the work I do. As in, when I give a good quality treatment, my patient is satisfied and I am satisfied. That's why I'm upgrading my skills. Not just that, at times there is a respect attached to it. That is, when you do good quality treatment, your patients are happy, and a good word about your treatment passes across. So all your peers in the area as well tell that you have a good clinical skill or a good hand. That's what most of our dentists answer. But my question is, why do these things matter? And if these things matter, what is the most important thing which links all of them together? The answer is happy patients. How does this help? If you do better treatment, better quality of work, and your patients are happy, automatically they are willing to pay you more money and do get more amount of treatments and services done at your clinic. Second, they are willing to refer friends, family, and other people they know, hence increasing the number of patients in your practice. Third, once they are happy, they do not have any trouble, you are satisfied with your treatment approach, and it spreads across that you are good with your patients. So bottom line has that we get in happy patients. But have you sat and ever wondered, what do our patients actually want? And these patients are of huge variety. You might have that old uncle walking into your practice with all his teeth shaking and expecting miracles from you. You might have that young IT professional walking into your practice, or a businessman having a total different concept of what he or she wants. Then there are those children. Some would walk into your practice smiling, while the others holding their parents' or grandparents' hand and slowly peeping as they are fearfully entering into your practice. Have you wondered what do these patients want? Usually there's a saying what we say is majority of my patients उनको क्या चाहिए? बस discount, discount and discount. That if we charge less or there is a discount, patients are willing to do more treatment. Correct? But I want to ask you one question. Have you seen practices which are charging very minimal amounts and still they are dearth of patients? They're not able to get enough patients they want. Have you seen such a practice? Second, have you seen practices which are charging a bomb like 2x, 3x the nominal charges what everyone charges, and they are still packed? The patients going in for high-end treatments, veneers, aligners, tooth whitening, and whatnot. Why is this difference there? The reason is we tell ourselves that patients want discounts, but there are patients who are willing to look beyond that and get treatment done. So, do our patients want good treatment? Do you remember that patient जिसने कहीं और रूट कनाल किया था 4-5 mm short and patient has absolutely no pain. Patient came into your practice, you did a perfect root canal and the patient end up with pain. What does the patient say? ये रूट कनाल इतने सालों पहले किया था, वहां पे बिल्कुल तकलीफ नहीं है, और ये जो रूट कनाल किया है इसमें मुझे दर्द हो रहा है. So patients don't understand what is 1 mm short of apex, what is complete sealed obturation. Patients are not able to differentiate between what a good treatment is and what a bad treatment is. So what do patients actually want? First, function. They should be able to eat. मुझे जो भी खाना है मैं आराम से शांति से खा सकता हूँ. Second, aesthetics. When they smile, people should tell कि your smile is beautiful or good. Third, they should have less or no discomfort during or after treatment. Majority of the patients who do not come for dental visits, what do they say? मुझे लगता है कि डेंटिस्ट बहुत महंगे हैं. रीजन नंबर 1. सेकेंड, मुझे डेंटिस्ट से बहुत डर लगता है. ट्रीटमेंट करते वक्त और ट्रीटमेंट के बाद बहुत दर्द होता है. करेक्ट? For now, these three things, that is aesthetics, functions, and less or no discomfort, two of them we take care by upgrading our clinical work and our skills, that is aesthetics and function. Or we hire consultants who do a better job. What do we do to reduce discomfort during and after procedure? During procedure, you might end up using anesthesia, nitrous oxide, and calming the patient down. But for after the procedure, since millennia, we have been prescribing medicines. Medicines usually in dentistry is antibiotic, painkiller, and an antacid to go with it, because हमें लगता है कि सारे patients को acidity होने वाला है. It's a general assumption. Antibiotic, we all are well aware. We give it because we are thinking there might be a source of infection and we want to take care of it. Then, what are these painkillers we give? They are basically NSAIDs, that is non-steroidal anti-inflammatory drugs. Why do we give anti-inflammatory drugs when we are assuming pain? The reason is pain does not happen on its own. It's a byproduct of inflammation. Inflammation means what? Whenever I take something or injure a person, it might be due to chemical, it might be due to viral, it might be due to bacterial, it might be just plain trauma. Whenever there is an injury in a site, localized region, there is a body reaction to it. That reaction is known as inflammation. Now, if you try and peep back in your physiology, you would have heard of 5 signs of inflammation. First was heat, redness, swelling, pain, and loss of function, or functionalacia as it was called. In dentistry, very few patients complain of loss of function. That is, especially maybe if you move a third molar, they might have difficulty in opening their mouth. Other than that, loss of function is not a major complaint. Second, heat and redness is again not a major complaint. The major complaints related to inflammation in a dental setting usually is pain and swelling. Why does this happen? Are all inflammatory reactions same? No. There are two types of inflammatory reactions. One is acute, which is the injury happens, the response is immediate, and it can be seen and felt. Chronic is that nagging irritation over a period of time. So you don't feel the damage in the short run, but over the long run, this inflammation keeps on accumulating, causing diseases. It could be cardiovascular diseases, immune response diseases, rheumatoid diseases. In certain cases, it can be even cancer. But when it comes to dentistry, we are mainly dealing with acute inflammation. Means the patient has a immediate response to an trauma which is there at that particular site. So why does this inflammation happen? Inflammation hota kya exactly? Remember when you pass through that road, maybe a Thane Belapur road or a Ghodbunder road, and you see an accident on the side. Once that accident happens, what do people usually do? They sit and watch. You see people parking their bikes, their cars, and looking at what happened. The people involved in the injury might end up calling their friends, family, and they would end up calling ambulance and the police to clean up and solve the situation. Similar thing happens in case of inflammation. Whenever there is an injury or trauma from outside, there is certain mediators which are released. These are like your phone calls, and they invite various other cells, inflammatory cells, into that site. Now, these can be of two types. One is cell mediated. That's basically all the cells which are already present in that area are inviting their friends. Second, once the blood supply enters into this site, there are certain plasma mediators which are released and they call in various other inflammatory cells. So this is how the inflammatory process begins or starts. The inflammation is an ideal process if you see. What it does is it goes and seals up the area, removes all the traumatized tissue, cleans it up, creating space for newer tissue to form out there. So mediators, which we are concerned with, is basically two types, plasma mediators and cell-derived mediators. Now, your question will be, पर मुझे उससे क्या? मैं एक डेंटिस्ट हूँ. I do regular extractions, RCs, implants, simple surgical procedures. Why should I be concerned about accident हुआ है, लोग क्यों आए, why the inflammation, why the hell about it? The answer is plain and simple. As dentists, we always deal with trauma. Either the patient might walk in with an accident, or the extraction you did is basically you causing trauma in the area, or the drill you did in the center so that you can place an implant, again you have caused trauma. The simple stitch you have given is also localized trauma which will cause inflammation. Yes, this trauma you're causing is for short-term pain but long-term gain. You remove that tooth so that the patient does not have infection later. For implant so that the patient is able to chew in the future. But these all things cause trauma. And if you ask patients what their problem with procedures is, once they can afford it, it's always fear of pain and swelling. So, our dentists, our responsibility is to take care of this pain and swelling. And we, for the homeostasis phase, either given a cotton plug, we give a cotton plug, put a collagen plug on top, or we give a suture. Can we do phase? No. We are mainly concerned with the inflammatory phase. Now, when it comes to inflammatory phase, we have been since ages using NSAIDs. Whereas there are newer molecules which have come which can help our patients better, but we are stuck with the older medicines and older drugs which we keep prescribing. Why is that? When there are newer medications available, one major change are certain enzymes which can help reduce this inflammation. And one such amazing combination of enzymes is TOLIP from Hetero Healthcare. Now, TOLIP basically has four enzymes, and the first enzyme is trypsin. I'm sure if you try and scratch your memory, you would have heard of this trypsin in your physiology books. Okay, it is basically created by the pancreas and enters the intestine that's near the duodenum through the pancreatic duct. That is we are aware of. तो imagine एक enzyme हमारा body already बना रहा है. It's already being made. Still, we are giving it externally. We are telling you give it to your patients externally. Why does that even make sense? And the answer lies that trypsin has three magic properties. First is it inhibits vascular permeability. Remember the start I told you when there's an accident, people just come from the road to see? So you're basically sealing off the road, you're sealing off the blood vessels. That prevents excessive inflammatory cells to enter the site. Second, you prevent release of pro-inflammatory cytokines. Remember the mediators I spoke about who call other inflammatory cells? So some of them are like tumor necrosis factor alpha, interleukin 1 and interleukin 1. These are the pro-inflammatory cytokines which trypsin tries and reduces or lowers it. The third is fibrinolysis. Imagine there is some accident which happens in your clinic or in the place where you are staying and a wall is broken. You would call the laborers to come and fix up the area. So they clean it up, they fix it up. Imagine after they do everything, they just leave all their material out there. The plaster is left, the instruments they have used are just left out there. Are you okay with it? No, right? It needs to be cleaned. Similarly, during fibrin formation, which is very good, it helps seal up the area, but once its action is done, the excessive fibrin has to be cleared up and cleaned out of the area. This is where trypsin comes in handy. So trypsin is basically giving you three added advantages. That's why it's an enzyme which you should prescribe. Now your question to me would be, but you're telling me theoretically trypsin ये सब करता है, practically does it make sense? And the answer is yes. Our colleagues, the MBBS ones, have been prescribing trypsin since a long time for various anti-inflammatory properties. They were not just giving it in ulcers, rheumatoid arthritis, but even in ocular disorders. They have seen that trypsin helps in healing faster. So you have an enzyme which is effective, you know the theory behind it, and it's already been used safely by our MBBS colleagues. So what is stopping us dentists from using it? To provide it to our patients so that we end up having happier patients. The second part of the TOLIP formula is bromelain. Now, bromelain basically comes from pineapple. Okay, why would we make an effort of taking out a fruit, taking out an enzyme from it, and giving it to our patients? The answer is the long list of advantages of bromelain. This includes decreasing prostaglandins, inhibiting bradykinins, again reducing the action of pro-inflammatory mediators similar to trypsin. The third part is slightly different from trypsin when it comes here. There it was fibrinolysis. Here it acts even before the fibrin formation happens. That is, it reduces the platelet aggregation. So basically, trypsin acts later and bromelain starts acting earlier. It reduces excessive sealing of the site. Again, is bromelain useful? And research has shown that our MBBS colleagues who have been prescribing this frequently have seen it helps reduce inflammation. For example, in one study, they gave bromelain before in case of sports injuries. And in certain set of patients, they did not give bromelain. And we saw that those patients who were prescribed bromelain pre-surgery had better healing post the surgery. So again, an enzyme which is effective. The third one is rooticide. Sources like buckwheat, tea, apple. Now, the advantages of rooticide is multiple. For example, it inhibits platelet aggregation, reduces vascular permeability, increases vascular flow. So basically, it does not let the vascular cells or inflammatory cells to enter into the site, sees that it reducing edema at the site. And similar to the previous two, it helps reducing pro-inflammatory cytokines, which we had discussed previously. Rooticide also has been used extensively by our MBBS peers for various diseases like arthritis and in cases of ulcer where they had to clean up the site. The fourth and the game changer enzyme is papain. Why am I talking about this? You might see other drug combinations which have the previous three enzymes, but papain is the one which has a synergistic effect or adds to the effect of all of these. And this is seen only in Tolib. Now, papain, how is it derived? It is derived from papaya. Have you seen a papaya fruit on a tree? It's greenish in color. They basically we have cuts on that, and there is a whitish latex fluid which comes out. Now, from that fluid, they derive papain, which is then added into the Tolib combination. Why would you go through an effort of doing all this? The reason being, papain strengthens blood vessels, it has an anti-inflammatory effect, antioxidant effect, and improves microcirculation. Remember, for the previous rooticide, we said the same. It helps the vascular flow. So whenever there is a good vascular flow, there is less accumulation of inflammatory cells in that easily be cleaned up. And papain, similar to the previous three enzymes, has been shown by our MBBS colleagues to be extremely effective, whether it's foot ulcers, leg ulcers, pressure ulcers, and even in cases of burns. Now, your question will be, why should I give four enzymes? And I'm sure you have read this or heard this before. When drugs act together, there is a better effect. This is known as synergistic effect. Similarly, when you add a combination of these four enzymes, there is a more synergistic effect. But the smart one among you would say, MBBS वालों ने यूज किया है, डेंटिस्ट्री में काम आता है क्या? Dentistry is totally different. My question to you would be, how do you study such an enzyme or a drug? In your clinic, imagine there are certain types of treatments you do. In one set of patients, you would prescribe this medicine. In a second set of patients, you would not prescribe it. And you will see which of these patients have a better response. Correct? And that is exactly what the top college in India, Savita Dental College in Chennai, has done. They found out surgical extraction patients, that's third molar surgeries who required, divided them into two sets of 20 each, sorry, 30 each. And in one set, they gave Tolib. In the other set, they did not prescribe Tolib. And post procedure, they followed up with patients and they saw patients who were given Tolib after the surgical extraction had better healing. If you do not believe me, read what is given down. Use of papain appears to be associated with reduction of soft tissue swelling and improved mouth opening when compared to conventional therapy. That is when Tolib is not prescribed. So you have a medicine which A, we know is effective. B, we know will help our patients heal faster. C, we know as dentists, all this effort we are doing is so that our patients feel and heal faster. Then why should we not prescribe it? So your next point would be, Satish, I know I need to prescribe it, but when should I prescribe it? And the answer is, whenever you are expecting swelling or inflammation or pain, that is in normal surgical extractions, normal trauma, jaw fractures, disimpactions, anywhere where there's a trauma, and you think it is going to take time to heal and the patient might have pain or swelling, prescribe it. Your patient will heal faster. What is the dosage? The dosage is twice daily as long as required. Not as long as required means what? First, if you do a regular third molar extraction, or a normal firm tooth extraction, how many days do you give medicines, antibiotic or painkiller for? 3 days, 5 days? Prescribe this for 3 to 5 days. If you are doing a major procedure, say a slightly complicated disimpaction or a more advanced implant procedure with a sinus lift or a GBR or something, how many days would you prescribe medicines? 6 to 7 days. So prescribe this for 6 to 7 days. Basically, wherever you feel you're going to cause some trauma and the patient might have pain and swelling, prescribe it according to how many days you give your antibiotics and painkiller. Why you should do this? Reason is, you remember those patients जिन्होंने एक जगह पे दांत निकाला, वहां पे उनको बहुत पेन हुआ, not during procedure but after procedure. Second place they go, they get an extraction done, and post procedure they do not have pain because during procedure दोनों में anesthesia दिया गया है. What does the patient ends up thinking? वो पहले डॉक्टर ने ना बहुत मुश्किल से दांत निकाला इसलिए बहुत सूजन आया, दूसरे डॉक्टर ने बहुत अच्छे से निकाला इसलिए बिल्कुल सूजन नहीं आया. At times, the first doctor might have done a third molar extraction. The second doctor might have removed a grade 3 mobile tooth. But patients do not understand this. So, to see that your patients are comfortable and they consider an amazing dentist who ends up with less post surgical or post operative pain, why not prescribe an enzyme which is available out there? But can you just prescribe it randomly to anyone? Is there any side effect? Remember in your pharmacology, what was the most common side effect you gave to all your patients in all your vivas? Nausea, vomiting, diarrhea. Similarly, for Tolip, it's nausea, vomiting, and diarrhea. So, are there cases where you will not prescribe it? Yes. First is, remember when we spoke about bromelain, it prevents clot formation only. So, imagine someone who's already on blood thinners like a warfarin, already clot का issue है, would you add this? Absolutely not. So someone on a blood thinner therapy, you won't prescribe it. Second, someone who is on sedative drugs or psychotropic drugs, you would not prescribe it because you don't want to cause inflammation in that area or the reactions in that area. Third, which is not an ideal contraindication, but I would ask you not to prescribe it. That is in pregnancy and lactating mothers. Why? The reason is it is not enough, there's not enough research to prove it is safe. It might be, but why do we want to take that risk? As dentists, the first law is do no harm. So, in these three cases, pregnant women or lactating women, second, those on blood thinners, third, those on sedative drugs. Other than that, in all cases, you can prescribe this drug. The reason to prescribe is it less post-operative discomfort per patient means happier patients. Happier patients means more patients, more money, and more satisfaction with your procedure. With that, we end today's session. So if there are any doubts, I'd be willing to answer them.
Participating doctors, if you have any question, doubts, you can just type in the chat box. Any doubts, question you have, please type in the chat box. So far, so good. I guess there are no questions. So thank you, Doctor. Thank you, Dr. Satish, for this insightful session on tolerance. I hope most of the question doubts are cleared. Thank you for a valuable time. Thank you, doctors, for joining in on this busy day, on a working day. Thank you so much.
Thank you.
Okay, so we end the session here. Thank you for joining in.